Welcome to the Polk Government Television special on the coronavirus disease, COVID-19. I'm Brian Lacey, and joining us in studio is Dr. Paul Banerjee. He is the EMS Medical Director for Polk County Fire Rescue. Dr. Banerjee, welcome to the show.
Oh, thank you for having me.
If we could, let's talk some numbers. From the U.S. standpoint, as of today's taping, what kind of numbers are we looking at?
Approximately, United States, I think there was about 8,000 cases. The death toll is obviously in the thousands. These change every single day. The numbers that we presented was basically from yesterday, and they're completely different today. But there is an escalation of mortality coming up now. A number of cases are going to skyrocket because there's testing now available, which wasn't available 3 weeks ago. The cases you see now are the ones that were positive from 3 weeks ago that are now symptomatic, and basically, if they're very symptomatic, they're hospitalized. If they're not symptomatic, they're being sent home.
Now, from a Polk County and Florida standpoint, what do those numbers look like?
As of yesterday, there were 92 cases. There were only 2 deaths. The age ranges were between the age of 3 and 88, so that kind of debunks the idea that it's only an old person disease. So there is a wide age group, and we've actually changed our protocol and treatment because of the age change. The other thing is there's been I think about 28 hospitalizations, maybe a little more, but only 2 deaths, which is good. Both of them were much older with comorbidities, and that kind of fits with what the kind of classic COVID partnership with end-stage disease or basically older people with risk factors causing basically the conjunction of the mortality.
As we were talking off camera and did the math, one thing that doctors would like to instill upon the folks at home, it is a horrible disease and death can happen, and death is a horrible thing. Talk to me a little bit about the numbers and the things that those in the medical profession are trying to get out to the people. Let's look at the numbers from a reverse standpoint. Talk to me a little bit about that, please.
So you look at this disorder, this disease, until recently there's no real testing, there's no real treatment, and the survival rate's about 98% or higher. Worst case scenario, per Dr. Fauci, there'll be 200,000 deaths. The population of the United States is 350 million. If you do the math, every one of those deaths is obviously a tragedy, but the numbers aren't as, I guess, as statistically significant or as massive as people want you to realize. So I guess the big thing is, look, same thing happens with the flu, same thing happens with other disorders. The treatment for this right now is social distancing. If you're carrying the virus and you're shedding the virus, and the virus is active on you for 14 days, remember 80% of people will be completely asymptomatic. So even though you have the virus, you won't know you have it, but you're basically a contagion. So if you go out in public and touch somebody, cough on someone, spread the droplets onto somebody, you're going to transmit it, and this basically it's a cycle that continues. The reason they want social distancing is that you stay home, you stay isolated, you stay with your family only. The longer you stay, the less chance you have of transmitting the disease, because the virus will probably die within 14 days or so. As a result, the less contact you have, the less transmission you have, and that's the only real treatment for this until we get a definitive treatment or we get a vaccine.
When you say shedding, what does that mean?
So you have the virus and you're containing the virus, and the virus is in your system, and it's releasing particles in the air. So when you cough, you sneeze, those particles are staying in the air. They're on your nose, they're in your mouth. So the virus is always growing and replicating up to a point where it tries to take over the host. When the host is able to fight back with the immune system, the virus dies. So until that virus dies, the viruses continue to live just like a regular cell in your body. It's going to continue to live and produce byproducts. The byproducts is the shedding of the virus. So this is what viral shedding is.
What are some of the symptoms that our residents should look out for?
Symptoms usually day 1 to 2, people will spike a fever. The fever will continue off and on for 5 days. Day 5, people start becoming short of breath, having difficulty, starting coughing a little bit. Day 7, 8, the difficulty breathing will get worse. Day 8, 9, and 10, either your body is able to fight the virus and resolve symptoms and get better, or the elderly with immune system compromises could progress into respiratory failure. They have to be intubated, put in the ICU, ultimately, and they can be there for up to 18 days. And the new statistics are that if you are over 65 with multiple comorbidities, if you're on a ventilator, survival rate is about 40%. So I try to focus on survival more than I focus on death, because I think if you focus on the death part, you just depress everybody. And let's realize that people can get this disease, and it's a horrible disease, but the survival rate is much higher than the mortality rate.
Let's talk a little bit about what's the response to COVID-19 coronavirus, if we could, please.
From a pre-hospital point of view, we have to assume everybody is COVID positive till proven otherwise. We are masking every patient prior to transport. Obviously, our crews are protected. If there is airway requirements, i.e. respiratory failure, or they need breathing treatments, gown is placed in addition to normal personal protection equipment. And treatment is basically administered on scene. If the person goes into respiratory failure or compromise, we'll pull the ambulance open the doors, obtain the airway to make sure that the virus isn't contaminated or contained into one ambulance, continue transporting to the hospital. After transport, we will spend time decontaminating the ambulance, which takes about 20 minutes before they go back into service. From a hospital point of view, working in the emergency department, if people present with fever, flu-like symptoms, what we're doing is we're doing the flu swab. They found that people with the COVID have low white count, high lymphocyte counts, potential chest x-ray abnormalities. If you have any of these and your oxygen saturations are low, those patients are admitted. If you just have a high fever and no other symptoms and everything else is normal, even if you are COVID positive, they'll send you home for supportive care.
You have close relationships with each one of the hospitals. How are the hospitals holding out during this within the community?
To their credit, they've really stood up. They've been accountable. They've gone above and beyond. Kind of feel guilty for keep asking them for things to help get our crews back on service. The hospitals are well under capacity right now. There's a surge program in place for every hospital. Winter Haven, Lakeland have found the ability to have testing for our crews so we can get the results back within 48 hours if they're symptomatic, or if they're testing a patient we transferred that was COVID positive, they can get the results back in 48 hours so the crews aren't quarantined for 14 days and they can go back into service. We're working with the other hospitals too. This is a new step for everybody, and it's a learning process, a growth process, but to everyone's credit, I think everyone's really come together, including Advent Health, Baycare, and Lakeland to form a phenomenal job for our community.
We mentioned some of the hospitals, but this is a collaborative effort. Talk about that collaborative effort amongst those responding.
I think people realize that this is a brand new problem that we're experiencing, and we're trying to be creative, think outside the box to find ways that we can optimize the care, protect our services, at the same time keep the staff and crew as safe as possible. So things that normally used to be at a lightning speed are now being jogged through instead of sprinted through, only because we want to make sure the crews are safe and the staff is safe. So simple things like you have a heart attack. Normally we take them, go to the hospital, they do an EKG, then take them to the cath lab. Right now they're taken to the hospital, they do vital signs, make sure there's no fever. The people who are doing the cath are gowned and gloved up. Then we take them to the cath lab to get the arteries opened. So things are more regimented, a lot more careful. The treatment is exactly the same. but we have to make sure there's no collateral damage for the treatment we have, and this has been a universal thing with all the hospitals we're working with.
As with any medical situation, there are protocols that need to be followed. Let's talk about the protocols and how they've advanced and changed since the COVID-19 and dealing with it, please.
For us, for a first responder standpoint, we have to assume everyone is a viral contagion until proven otherwise. So everybody is COVID positive. So it's different when they come to your door and you call and you're having any symptoms, don't feel uncomfortable. Why am I being masked? Well, the reason is we just want to prevent you could have viral shedding and not know it, and you could have the virus and not realize you have it. So to prevent that shed, we put masks on you. This virus is about 80+% similar to SARS. SARS occurred, and SARS was aerosolized and droplet. They're stating this one is primarily droplet based, but to me, if you are 80+% similar to some other virus, there may be some aerosolized component to this. So as an overabundance of caution, anything that's going to be aerosolized or release virus to the air, we want our crews to be protected, and that's why they're doing the masks. We're having gowns for those. We bought hepatofilters, which are placed on ventilators or any patient that's transported with respiratory failure to catch any viruses that will be released by the patient and not aerosolized in the air. So there's things we're doing that are different than what we did before. We've been buying a lot more PPE, being creative in our PPE. You'll see people in Tyvek suits going, why is there here for us as a decon or a hazmat? No, we just didn't have enough isolation gowns. This is a gown that will protect the crews from spread of droplet, and this will be a temporizing measure till we get more disposable gowns in. So we try to be creative, and there's a mask, there's a K95 mask, which is basically a different type of N95 mask that's not quite as good, not quite as effective, but probably is equal to like an N85 mask, N90 mask. When we're short, we have that as a backup. If we're really short creatively wise, there's a study that showed that you can bake these masks in 70 degrees for 30 minutes, keeping the integrity of the mask to prevent the viral entering or 95% of particulate entering your mouth. So things are done a lot more in the open air, not as much confinement, more protection. People are cautiously walking through everything without having to just come and react. So there's just a little delay and making sure everybody's doing the right thing before we initiate care.
Dr. Banerjee, I'd like you to explain to our residents what they can do to keep safe during these times.
It's hard. This too will end. Hopefully by the end of May, June, we can kind of resemble some form of normalcy. But the reason behind social distancing is the less exposure you have to others who may have the virus, the less chance the virus to continually spreading and touching everybody. So I know we miss family. I know you want to spend time with family, and if people want to come down from other areas, as of now, say no. You don't want that virus to be spread from wherever they're coming from onto you, especially if you're older, especially if you have any kind of immunocompromised conditions. This is a time to there's Zoom, there's Skype, there's FaceTime, there's a phone. Please keep contact with your family. The biggest things I worry about are people getting depressed, feeling that there is no hope. There is a lot of doom and gloom on TV. Realize there is over a 98% survival for this disease. Realize this too will probably be better in about 1 to 2 months. Also realize we're working on a vaccine, they're working on treatment, they're working on testing. This will get better. And the worst thing is you're stuck at home with family, which may or may not be good. But the fact is, that's the best treatment you can have to not overwhelm your healthcare providers, not overwhelm your hospitals, and keep this viral contagion down. The problems you have in New York City is you have 11 million people, you don't have 11 million beds. And that's why there's overflow, there's a surge, there's a shortage of ventilators. You plan for Usually you plan for a worst case scenario, but most people budget for best case scenario. And this is why we're in the situation we're in. Thankfully, we're not there yet here. And we're very aggressively monitoring, taking care of the situation. Hospitals are working diligently with us. The partnership's been amazing. And I'm very confident in the treatment and capacity that we have to take care of people here.
Dr. Banerjee, I want to thank you for joining us and thank you for your input on the situation.
Thank you. Nice to be here.
For more information locally, you can give the Florida Department of Health in Polk County a call at their dedicated COVID-19 Information Center line at 863-519-7911 or go to floridahealthcovid19.gov. I want to thank you for joining us, and keep in mind that we are all in this together.